Hello, hello, beautiful nurses. And today's session, we're going to talk about wound dressing guide to help you what sort of dressing needed to put on. And not just that, we're going to talk about different wound classification as well. What are the comorbidities that affects wound healing, and your wound assessment, of course, very important whenever we do a wound, and infection prevention and control that you need to be observing when you do your wound dressing, and the appropriate dressing that way gonna look into as well, and the documentation and when to escalate in line with the Australian, New Zealand healthcare standards. And so in Australia and New Zealand healthcare context, wounds are generally classified based on cause, healing process, and clinical appearance. And this classification, of course, it does helps the nurses and healthcare providers to determine what sort of treatment and management strategies that we need to be putting in place, or the different wound dressing, of course, that needs to be utilized according to the wound that we're dealing with, right? And so let's talk about, in terms of wound classification, of course, you do have your acute wounds and the chronic wounds. When we talk about acute wounds, as you probably know, these are like sudden injuries. Some good example would be your, lacerations, burns, abrasions, and surgical wounds. In terms of your chronic wounds, this is very well evident, especially if the patient has got comorbidities, meaning they have other medical issues apart from what they're dealing with, specifically problems with blood circulation, right? Which we're going to talk about in a bit of a detail in the following slides, but these are the example of your chronic wounds. And also in terms of wound healing process, we do have the primary intention, secondary, and tertiary intention. Usually with your tertiary, these are the wounds that are deep, we usually pack it sometimes, or to manage infection to start with. With your primary, these are your surgical incision, for example, and the secondary, one of a good example is your pressure ulcer. All right, and then we do have, according to clinical appearance, we categorize them to clean wounds, contaminated wounds, clean contaminated wounds, and infected wounds. And as a nurse, we need to be able to assess the clinical appearance, especially if the patient has got some wound infection. And that's why I want you to be familiar, or you need to be familiar with your signs and symptoms of your wound infection, given that as a nurse, we need to learn to escalate this to either a wound nurse specialist or a doctor. Usually, if a patient has got some infection that we've observed, in Australia, New Zealand, it's upon nurse's discretion to collect a wound swab, send it to pathology just to check whatever virus or bacteria that is brewing in there. So then the doctor could prescribe antibiotics that either that are sensitive to the actual bacteria or virus that is found in the wound swab that we've collected. All right, and so in Australia, New Zealand as well, these are, test procedure that are done for free. If we think that the patient needs it, we then just collaborate to the doctor and collect a wound swab, send it to pathology. Okay, and so that's according to clinical appearance. Now, according to tissue, the tissue type, we do have the necrotic. Okay, so like this example right here, it requires debridement, of course, meaning that needs to be removed. So then the wound will, continue its stages of wound healing. Yeah, because if you don't remove that, of course, it's not gonna heal. The wound's not gonna heal better. And then you do have the sloughy wound right here. Usually, sometimes you'll see this in an infected wound. And some of the discharge could be yellowish, greenish. So these are the things you're expecting. Granulating, you can see the edges are looking good and it's, nice and red. And you can expect a, normal wound healing process. Same with this one. It looks chronic, however, it's already healing well. You can see there's a new skin forming around the edges, right? So, yeah, so those are the different wound classification. Now let's talk about the common comorbidities affecting wound healing. So in relation to that, again, as a nurse, we need to be familiar with this one, given that the wound could be delayed as expected, given that they have these comorbidities. Now, in relation to some other comorbidities like, osteoporosis, say, for example, there's an impeded blood circulation happening as well. And so that could delay the healing process. And some of the things get missed out on advanced age, right? And so these are the things that we need to consider as an RN. And obviously, depending on the size of the wound, I know we know that there could be some wound delayed there, but we could still be expecting it to be healing. It's just that, it does takes a bit of time. And yeah, we can rationalize it or include this into our assessment. Now, in terms of wound assessment, it's very important, of course, to correlate the actual or, holistic history of the patient himself. What are, like what was the cause of the wound? Like how long did the patient had it? Is there any other comorbidities like what we've talked about? Because these are very important things to consider and expect if the patient's wound's going to heal well as expected. Now, in terms of the look, in terms of size, again, if it's just like an acute wound and patient doesn't have any comorbidities, the size might not be, relevant in terms of documenting it well. However, it's just good to take note of it as well in the first time and, saying that updating the patient, it doesn't look that big, right? However, if the patient has chronic condition, chronic, wound, delayed wound healing, comorbidities, it's very important, of course, to take note of the size of the wound, right? So those are part of your assessment. In terms of the framework, in terms of what needed to be assessed, apart from what we talk about, is the tissue, right? And then if there's any signs of any infection or inflammation, how's the moisture of the wound, because it's very good for wound healing. And the edges, is it, according to the stages of wound healing as expected. So these are the things that we need to consider. Again, of course, your infection prevention and control whenever you carry out your ANTT. Remember your 5 moments before and after touching a patient, before and after a procedure, and after touching the patient's environment, very important. So we're not spreading, any of that virus or bacteria, right? And in terms of PPE, of course, patients, say, for example, has gastroenteritis, got VRE, MRSA, obviously full PPE would need to be observed, and ANTT whenever we're doing the wound dressing itself. In terms of proper waste disposal, of course, we only dispose the patient's equipment that we've used to clean the wound. If the patient's infected, of course, everything has to go through the clinical waste bin. If we use sharps to debride the wound, then obviously this needs to go to the sharp. But if the patient's wound are simple, non-infected, all of these equipments we've used or the garbage that we've used will just need to go through the general waste bin. Now, let's talk about now your types of dressing. So there are different types, of course, as you can see here, which we're going to go through in the next slides. We do have the semi-permeable dressing. And as an RN, you don't need to confuse yourself based on the brand. Okay, so as you can see, these are all the same semi-permeable. and it's a low adherence, as what's its name, what's its other name is called, and usually good for a mild to moderate exudates. Usually also after like using a surgical wound, not unless the patient has got heavy to moderate or large exudates, right? So this isn't appropriate. All right, so these are the things that it could be used for. Some are waterproof, some are not. Okay, so just make it appropriate to the patient's wound, and say, for example, if it's a surgical wound, it might be best to use a wound, a waterproof dressing, right? So then the patient could shower with it. Now, your non-adherent moist, one of the popular one is your Gelinet or your Bactigra. All right, so these are used obviously for a wound that is superficial and it's already healing well. And one example when you say superficial is the burns, right? And these are ideal for those ones. It provides a moist environment that is very good for wound healing. It does need a secondary dressing though, or a bandage to keep it in place. Now we do have the non-adherent dry dressing. This could be put on top of the your non-adherent moist to keep it in place because it does absorb some of the exudates as well. And obviously used for patient if the patient has got some allergy to adhesive, right? And it does needs a secondary dressing as well to hold it in place, given that it will just go on top of the wound itself. You can also use this Hypafix as well to put the that non-adherent dry dressing in place if the patient's not allergic to adhesive. All right. Usually these ones are used to keep the um, uh, put the obviously the primary dressing in place. And so the other thing is your Caltostat. Now this is antimicrobial in a way that it eats up that slough in the wound. It's also used if the patient's wound is a little bit deeper in depth, and so that provides, absorption and eating up those sloughs. So that's what it's very good for. It obviously needs another primary dressing to go on top of it, or either that or a secondary dressing. All right, so that's your Caltostat, usually antimicrobial. And also we have the foam dressing. Again, these are used especially if the patient have comorbidities, right? And there's usually a delay in wound healing, hence there's going to be much more exudates than usual, and this is very good for that. There are obviously foam dressing that doesn't have adhesive as well, needing to have the secondary or um, bandage on top of this particular type of wound dressing. And usually this particular foam dressing, they're usually good up to they can say up to 5 days. All right. And so, yeah, so, and they're very expensive as well. With this hydrocolloid dressing, it kind of serve as a second skin onto the wound. So that's why it's only recommended if it's, usually it's healing already. It could be burns or small abrasions. And you just leave it in there until the wound is all closed. It does retains the moisture as well. All right. So these ones, you can't use it for infected wound or like a little bit of a deeper wound. Okay, now we do have the intrasite, just in case the patient's wound gets a little bit dry, the edges gets dry already and it's still needing that moisture. So that's what it's good for. It obviously needed an extra primary dressing on top. And we do have the adhesive tapes. And this is to secure, of course, your secondary dressing. However, with your Steri-Strip, it's usually used if the patient had a skin tear. So it does put that skin, back to its place or usual position. Usually our elderly patient needs Steri-Strips because of their skin integrity, right? And so that's very good for that one, keeping it nice in place. And we do have another antimicrobial just to keep the wound dressing covered, protect it from any virus or bacteria. And by the way, guys, the low adherent or your semi-permeable dressing, forgot to tell you, it do comes in different sizes. All right. And so you just have to use the appropriate size according to the wound that you are dealing with. Now, in terms of escalation, of course, as we've talked about earlier as an RN, as a nurse, you need to know if the patient's wound is, spreading infection, if there's any increased pain, any systemic symptoms, delayed wound healing, like more than 2 weeks. These are the best time to escalate or refer to a wound care specialist, to the doctor, or if you work in a medical practice or clinic, you need to, a more specialized wound clinic to have a proper look of that wound so then we could heal the wound faster. Now, in terms of documentation as an RN in Australia, New Zealand, mainly the charts are electronic already. And so in terms of documentation, majority of the time you're documenting the appearance, the dressing used, and the size, and make sure that you're following the hospital's policy and procedure because it's different in every hospital. And also another example of a wound form is this one that you might come across. Usually, we have a good look at this one prior to doing the wound dressing for us to have an overview or to see what are the things that has already been done for the patient and to monitor the progress, right? And as an RN, you've done the wound dressing and assessment. You're the one now to put or document your or what you've observed in the patient's wound. To help you with best practice guidelines, you can access Wounds Australia or New Zealand, Australian National Wound Guidelines. Follow your local health district protocol, specifically your hospital policy and procedure, because it's very different in every hospital. Well, not like a huge difference, right? But different policies, different procedure in every hospital. And I hope that gives you a much deeper insight into what sort of dressing that you need to use. Again, if you're not sure, patients once become gotten worse, always refer because we do work collaboratively in Australia and New Zealand as an RN. There are specialists that are willing to collaborate with us. Now, in summary, make sure that you are assessing the wound before you dress, given that obviously you can't really give the update to the patient, not unless you cleanse the wound, right? Usually there's going to be debris in there, dead skin cells oozing, and it's very hard to update the patient's wound. You need to give it a good cleanse as well first. Maintain ANTT, of course, whenever you do a wound dressing, and choose appropriate dressing is very important so then we could heal the wound faster, and document accurately, of course. Remember, as an RN, if it's not written or documented, it didn't happen, right? Escalate when necessary, of course. And I hope that gave you an insight onto what sort of dressing needs to be used. And again, for those of you who are needing guidance in their OSCE preparation, contact us at AUR and Pathway. We do have OSCE preparation in Australia and New Zealand. Very concise, very straightforward for you. We're not going to waste your time, only the things that you need to learn. And so if you have any questions, like or comment, don't forget to subscribe so you get notified whenever we upload informational videos for you. See you next time. Bye.